for patients with endometriosis, they have persistent pain,
yes.
and of course, it could address a problem with infertility. Sometimes a week, they can do ballroom dancing already.
Wow. Good day, everyone. I'm Dr. Jing, and welcome back to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our St. Luke's experts. In today's episode, we explore the latest advancements in medical technology that are transforming patient care. Joining me is Dr. Elsie Pascua, a St. Luke's gynecologist and a robotics surgeon. Thank you for being here, Dr. Pascua.
You're welcome.
So I'm so happy you are able to join us today.
I'm so happy too.
To start, what are the key advantages of using the Vinci Xi surgical system in our women's healthcare procedures?
You see, Jing, this the Vinci Xi surgical system revolutionizes the surgical procedure because of its unparalleled precision, dexterity, and visualization. So by nature, robotic surgery is actually minimally invasive. So we surgeons, we have very small incision.
Okay.
And of course, if there is very small incision, less trauma to the surrounding tissue. And because of this, the patient has minimal to very little post-op pain. All right?
That's good.
And of course, there's less scarring. Now, because of the precision of the procedure too, the surgeon can operate with minimal blood loss. And of course, there will be also less complication, less risk of infection. And given all these things, the patient definitely will have faster recovery. Now, the versatility also of this system allows a surgeon to do complex procedure accurately, so the outcome is really very well and very good. So definitely you will see that the robot system is very patient-friendly. Now, luckily, it is also doctor-friendly, surgeon-friendly. Because of its ergonomic design, the surgeons are empowered to do very accurate and meticulous surgery.
How does the robotic platform enhance precision, control, and visualization compared to the traditional type of surgery, Doc?
So as a robotic and laparoscopic surgeon, I can attest to the distinct advantages of the robotic surgery over that of the traditional open surgery and laparoscopic surgery. Now, number one, or firstly, it offers a superior visualization with high intensity and three-dimensional imaging. It could magnify the field, and of course, you could see clearly. And then, of course, with this superior visualization, we could locate the anatomic structure and work on very complex procedure in a limited space.
That's
All right.
very space-saving as well.
Okay, so that's first. Then secondly, it's the robotic instrument. Now, the robotic instruments are very precise and has a finer control. Okay, so we actually use wristed instrument where it mimics, the natural movement of the surgeon's hands. Because of this, we can be able to dissect, we can suture, and then manipulate tissues, no? Another advantage of this is that in the laparoscopic surgery, there is less dexterity, okay? So versus the robot, the arms of the robot, okay, has a wider range of motion. So because of this, we can reach even the unreachable, supposed to be, or difficult area in the pelvis. So I would say that these are the advantages in terms of the instrumentation. In favor of the surgeons, it has ergonomic design. So the robot console, the surgeon is seated there comfortably while doing the operation. So we can actually do the operation even at extended period of time. No?
So
definitely superior performance.
Better outcomes.
Yes, better outcomes. And then the intuitive control and ergonomic setup of the robot also allows us to, reduce the musculoskeletal injury that occurs when you do the laparoscopic surgery. So overall, I would say that it offers better outcome because of its precision, better control, and dexterity, and better visualization.
To clarify, Doctor, iba pa pala ang laparoscopic and robotic.
Yes, yeah. Because with the robotics, you use the robot, no? You know, if this is the patient, for example, you dock the robot and you dock the arm of the robot.
There.
And the doctor is seated in the consult table, and the assistant will be staying beside the patient. And so the surgeon, the robotic surgeon, will be the one to manipulate the arms
From
of
a
the robot.
distance.
Yes, from a
Ang galing,
distance.
ang galing.
Remotely.
Yes, remotely. That's very amazing. So, Doc, can you provide specific examples of how robotic surgical systems enhance visualization and precision that have benefited your patients?
Like, for example, because of its precision and better visualization, like in cases like myomectomy, you can be able to visualize, no, the fibroid and separate it very nicely from the natural or from the normal myometrial tissue. So you can be able to do myomectomy, I would say, very clean, no, because you could really define and see, no, clearly the difference between the fibroid and the normal tissue.
So,
For example,
myomectomy is removing the uterus.
removing the
a part.
fibroid,
The fibroid from the
myoma.
uterus.
So the uterus is still there, but you just remove the masses or the fibroids or the
Okay.
myoma. Now, because of its precision and dexterity, also in hysterectomy, for example, we can do accurate dissection and suturing and better hemostasis. So again, better outcome for the patient. And because of its three-dimensional feature, no? Like in cases of endometriosis, you know, the endometriotic implants, we could be able to visualize and locate where it is, and we could just excise it very neatly, I would say very neatly, and so the outcome will be good, no? Because, you know, for patients with endometriosis, they have persistent pain,
yes.
and of course, it could address a problem with infertility.
So, Doc, what about procedures that are particularly suited for this advanced robotic technology? Have your patients responded well?
You know what, Jean? Anything that you can actually do by open technique, you can do it by robotic surgery or minimal invasive surgery. So you can do hysterectomy, you know, ovarian cystectomy, you can do myomectomy. The exception, however, is for ovarian cancer. No, we don't recommend you to do surgery for patients with ovarian cancer because of risk of spillage. You know, when you inadvertently rupture the ovarian cyst, then the content could spill.
Spread.
So we don't recommend ovarian cancer to be doing robotic surgery.
Okay.
And because of the very small incision, pose of pain is less blood loss, less complication. So the patient feels well right away. So after the surgery, a day or two, when they pass out flatus, they're ready to go. They move around, they ambulate, and they're the ones, doctor, I want to go home already. And you know, recuperation is very fast, and they enjoy it because they just recuperate at home. And when I say recovery time is very short, they can actually go back to their routine activities, go back to exercise, go back to work in a very short period of time. There are some differences depending on the patient. You know, sometimes a week, they can do ballroom dancing already, but others are more sensitive, so they take their time. Generally, there is very high patient satisfaction. They love robotics.
Robotic surgery. In fact, it would translate to lesser hospital-acquired infections, you know, because of the shorter stay. It's really a groundbreaking technology that we have here in
and because
in the hospital.
it's very small incision, less infection.
So, Doc, how has the robotic surgical system reduced recovery times and hospital stays in your female patients?
Well, this robotic system revolutionizes the process of removing whatever we
Needs to
have.
be
No?
removed.
So the key benefits here are minimally invasive nature of robotics. So you have very small incision. So with very small incision, They complain less of pain post-operatively. Actually, post-op, sometimes they wouldn't really need any post-op pain afterwards and less scarring. And because of the dexterity and precision, as I mentioned earlier, the surgeon could operate with less blood loss. Okay, risk of infection is low. Okay, so again, it boils down to, with these things in our mind, the patient easily recovers and is heading to go home right away.
Lots of benefits, less needing backup blood donors and all that comes with surgery from before. Yung talagang open surgery, then you have to prepare a patient very much, as cardiovascular wise.
Right. After the surgery, the following day when I make my rounds, where they pass the flatus, you're just walking around. So less hospital stay, so they can recuperate in the comforts of their home.
Doc, what are the key safety features built into the Vinci Xi system to ensure the highest patient care and surgical precision?
Well, the robotic system of the Vinci actually incorporates several key features. Okay, number one is its high definition imaging, so better visualization. Number two is the robotic instrument, the wristed instrument, which I mentioned to you earlier, that it's as if it's the surgeon's hand that is moving. All right, and so again, you can operate with precision and accuracy. And number three, they also have this feature of tremor filtration and motion scaling, so this will minimize impact of hand movement in the surgical procedure.
Tremor filtration.
Yes, tremor filtration,
if you're it can stabilize.
Correct.
That.
And of course, they have this additional feature wherein the surgeons has this input of every single surgical maneuver they do. Then, of course, they have this built-in safety feature wherein it prevents the instruments from colliding, right? So instrument collision is avoided. And there is real-time monitor of surgical parameters to ensure best outcomes. So overall, we have this safety key features which is installed in the system, of course, to prevent complications and to ensure the highest care for the patient.
That's nice to hear. Doc Elsie, how does the robotic surgical system platform expand the capabilities for women's healthcare surgeries?
Jing, it has significantly expanded capabilities of surgeries because number one, it offers advanced technology done in precise and minimally invasive way. So greater accuracy, efficiency, and better outcome. Secondly, it allows the surgeon to perform intricate procedure, even reach the hard areas. Like, for example, the pelvis is the cul-de-sac, no? You have the arm of the robot could reach that, no? So we could be able to dissect or be able to get tissue like in endometriosis, even if it's very hard to reach. Overall, it empowers surgeon to deliver the highest quality care. So in short, because of the highest quality care, you have improved patient satisfaction and outcomes.
Doc Elsie, as an experienced Da Vinci surgeon, what excites you the most about this technology?
Before, it's impossible and improbable. But now it's here in our hand. It's here in our home in St. Luke's Medical Center. So therefore, I would say that I envision them to be continuously researching and doing advancing the technology so that we could perform more complex procedure that could address wider range of gynecologic concerns. So, Jing, I would really wish that, we could inspire confidence in the future of women's healthcare, driving us to push to the boundaries of all the possibilities in robotic surgery.
Thank you, Dr. Elsie, for sharing your insights with our audience and especially on this Da Vinci Xi surgical system and its impact on women's healthcare. Dr. Elsie, thank you for joining us to MD in Focus.
Thank you also for giving me this opportunity to talk about the latest technology that St. Luke's brought here in our hospital. So to all the females out there who have some gynecologic problems, please visit us, have consultation with us, and definitely we will give you the best service.
Thank you for joining us on MD in Focus. And this is Jing. Thank you for tuning in to MD in Focus. Remember, your health is your greatest wealth. Always consult your specialist for more reliable health information. Remember to click the follow button, and until next time, stay well.